Middle East kick-started 3 years ago, and it was our first footfall into the Middle East and going international. People generally think of Priory and they think of Priory UK, and they also think of rehabilitation and things. But there's so much more to us at Priory. And Priory here in the UAE is our first clinic that's opened up, and we focus on well-being. So we will focus on patients coming in and doing their one-to-one appointments here, just coming in, having their one-to-one session for an hour a week, and then having their diagnosis or their therapy sessions. We do work with a lot of schools. The work that we do primarily with schools focuses from the range of working with students, working with teachers, working with some of the well-being advisors at the schools, and the pastoral care to assist them in any critical situations that they might have, or providing any sort of consultative type work as well. Because we are, in essence, responsible for or playing an active role in someone else's life. Teachers are at risk, which is now an international concern, not just in the Middle East, but an international concern in regards to working with children, working and expecting to be inspirational and motivational to these children. And they're with these children for a good chunk of the child's time during the day and for 10 months of the year. So they are developing these bonds and these relationships with these children, and at 24 or 25 of them in a classroom at any given time, there are moments where they're going to feel sometimes undone or a bit afraid when they're working with children. And then when we add on the extras of what the teachers are expected to accomplish in their time, their teaching year, it does add to a lot of stress and a lot of expectation on the teachers. So I think what's happening in the UAE is actually a really good thing. We are bringing awareness to mental health and bringing awareness to perhaps the feelings that people were having but weren't quite able to identify or to name it or to even talk about it, to feel safe and comfortable to talk about it. So I think that it's coming to the limelight, coming to the forefront for us to be able to discuss that. Why is it that UAE teachers or any expat teachers, I'm going to put them all together, are at a higher risk? Is because teachers that come here or to any expat society are leaving behind their friends, their family, their social support network. They are also being exposed to a new culture, new way of expressing their curriculum and of teaching, and then also the transiency, the nature of making friends, having that bond with the teaching staff who quite quickly become your family here, when expatriates come, and then all of a sudden they leave. So it's sometimes it can be quite difficult to be living in a transient type environment as well. So I think with teachers, I think the first step starts from a top-down approach. So I think it starts with the principals and your key administrators at the higher level. If we go with a top-down approach and we have them create a safe space for teachers to be able to come in and to communicate, for teachers to feel like they can say, I'm struggling today, I'm not okay, that they know that they won't be penalized and they won't be held accountable for that, but rather sit back and be supported in that space. The next step I would suggest would be for teachers to be able to communicate with their colleagues, to communicate with their line managers, to be able to say, you know what, I need some support, to not isolate, because as we start to feel stressed and we start to feel burnt out, we tend to cocoon and go back into our space. So it would be more for people to recognize that we can communicate, and it's okay for us to be feeling untethered sometimes, and that's normal. And then the other thing that I would recommend would be that in professional development days, that there be a lot more awareness to not just how we're going to communicate this curriculum and teach the curriculum, but also how we can utilize the strengths that our teaching staff brings and how we can ensure that we are looking after their well-being. So we work with, like I said earlier, we work with students and we will hit hot topic areas. So a lot of the pastoral care will come to us and say, we're noticing these issues today. Would you be able to come in and do a little bit of an information type session for these students? So for example, we work with Year 6 students as they're moving up into the senior school. The anxiety that they would naturally feel moving from being the eldest in the junior to now being the youngest in the senior. What does that feel for them? We also work with the senior school students that are going through their IGCSEs or going through their sixth form or IB. How do we manage our exam stress? How do we manage leaving home, which is coming up for us, you know? And then also talking to parents. What are the things parents need to be mindful of with social media so heavily into our students right now? How do we manage the bullying that goes on? The staff, how do we be aware of those students that are being, you know, struggling with eating disorders or are being bullied or having some body dysmorphic issues? How do we work with awareness of the staff? And then we also work with the burnout of staff. And I hate using the word burnout because it's such a sensationalized word. How do we help the staff manage their stress and create some healthy tools for their toolbox that they can carry around with them for their well-being? So given that the audience would primarily be, the top-down, would be our principals and senior leaders, and then also our teachers, what I'd like to really do is to bring awareness that we are at a higher risk. Teachers are at a higher risk of compassion fatigue and feeling really exhausted. Then the other step would be, the other piece that I'm wanting to bring awareness to is how does that manifest itself? What does that look like? What do the symptoms look like? So when teachers are feeling a certain way, we sometimes attribute it to, I've got just a really bad, nasty cold that doesn't go for 6 months. Well, perhaps our immune system is fatigued, which is a cause of, you know, having the stress that we carry around with us. So it's a bit more of how do we bring awareness to the symptoms that a person may feel. And then the other piece of it is what can we do now that we know where we are. What I really want to do is to have an impact-oriented session, a session where teachers can come out and say, I learned something there and I now feel like, okay, I can, if I do 1, 2, and 3, which are really simple things, maybe I'll be a little bit happier and a little bit more balanced and a little bit more focused in doing the things that I love to do, like teach.